91. What is a fungus and what is the term used to describe infections caused by fungi? The answer is a fungus is a fungal infections or mycotic infections. It is yeast and mold like 92. Which superficial fungal infections are commonly seen? The answer is, the superficial fungal infections that are commonly seen are Tinea capitis, which is scalp ringworm, Tinea cruris, which is jock itch, Tinea pedis, which is athlete's foot, Tinea corporis, which is ringworm, onychomycosis, which is nail fungus, and Candida albicans, which is yeast infection. 93. What medications are used to treat vaginal mycotic infections? The answer is, the medication that is used to treat vaginal mycotic infections is the miconazole. From Monostat. 94. What are some adverse reactions topical administration? The answer is, some adverse reactions of topical administration are stinging irritation, dryness, or redness at the application site. 94b. Systemic administration NVH and abdominal pain. 95. What instructions should you give to the client who is applying topical medication miconazole to the vagina? The answer is, the instructions you should give to the client who is applying topical medication miconazole to the vagina: wash hands, wash area, wear gloves and use an applicator, finish the course of treatment, and use a sanitary napkin to prevent staining. 96. What is the main responsibility of the site when the client is receiving IV amphotericin B? The answer is, the main responsibility of the site when the client is receiving IV amphotericin B is monitor for adverse reactions such as inflammation and redness at the site. 97. What instructions should you give to a client who is receiving treatment for ringworm? The answer is, the instructions you should give to a client who is receiving treatment for ringworm is isolate the client and avoid exposure to direct sunlight due to photosensitivity, extreme sunburn. Next question: how should the client's clothes and linens be washed? The answer is, the client's clothes and linens should be washed separate. Separate the infected linen from the client from the non-infected linen from the family, and wash in hot water. Number 98. What instructions should you give to prevent recurrence of fungal infections? The answer is, the instructions you should give to prevent recurrence of fungal infections are: finish the full course of treatment, and also take exactly as prescribed. Number 99. What test is ordered when helminth infection is suspected? The answer is, the test that is ordered when helminth infection is suspected is the O&P test. The O&P test is an ova and parasite test that looks for intestinal parasites and their eggs. Their eggs are also known as ova, by checking a sample of your stool or poop under a microscope to look for intestinal parasites. They are tiny life forms that can live and reproduce in your digestive system. Number 100. What PPE is necessary when treating a client with helminth infection, and when should the PPE be worn? The answer is, wear gloves. The PPE should be worn when changing linens, or when emptying bedpans.